Hello, in this video we will understand about the alopecia areata. This is the non-scarring hair loss, remember. And this hypothesized is basically it is an unknown fully about the alopecia areata infection or the causes. But we will understand about the theoretical hypothesis the follow the collapse of immune privilege of hair follicle, and number one thing is that, and which result in an increase in self peptide. Self peptide mean the follicular cell will represent the self peptide like MHC expression, major histocompatible molecule 1 and 2, and along the follicular epithelium and active inflammation. On the other hand, the interferon gamma has been identified as the key player in alopecia areata pathogenesis and many other cytokines such as interleukin 2, 7, 15 in augmenting disease. So the causes is unknown, but here we will understand about the hypothesized causes. The it show the sign and symptom is the baldness with patches and hair loss on skin. Causes can be a high fever, severe infection on major surgery, and the illness, as well as sudden blood loss, severe emotional stress, a crash diet, like especially those do not contain proteins. So in this video we will understand about the pathogenesis and the skin structure and how it can develop the hair. Here is the skin which that contain basically hair. This is the hair shaft is the outer part of the skin here which that is appear the hair and it is dead. And this is the hair follicle. Hair follicle contain a hair follicular cell, and this hair follicular cell is important for the sport of the sport and development of the hair. While on the other hand, it is beta carotene containing protein, and this artery and vein is used for the oxygen of the hair root. This is the hair root, provide the oxygen for nourishment, and here is the nerve, and here is the epidermis, and dermis contain nerves, blood vessel, and hypodermis contain subcutaneous layer of adipose tissue. Anyhow, the pathophysiology or pathogenesis we will understand in this video now. First of all, we will understand about the development and growth of the hair. Here we can classify the growth on the basis of the category, the anagen and catagen and telogen. These three phases, which that is number one is the anagen, and the anagen is basically important and it will lead to increase tumor growth factor beta and interleukin 10 and alpha MSH. While on the other hand, the follicular epithelial cell for normally function is protect due to low MHC proteins expression and lack of the danger and stress response. In catagen, the basically hair shedding begin, and in this way the hair will not shed, but in catagen the follicle diffuse, and in this way become to separate through blood vessel and hair. And this is basically is the separation of blood vessel and the dead follicle, and in this way the separation is the telogen, and in this way the hair will be lost in the telogen phase, and then again the return to anagen and the new angiogenesis and follicle formation to anagen. This is a simple information of the development of the hair and growth of the hair. In alopecia areata disease, we will understand now. So in this way, normally the follicular epithelium will not show the MHC molecule, MHC marker, and in this way, the in alopecia areata, it show the MHC molecule for representation itself, the follicular cell. In this way, it will damage the follicular epithelium, and it is due to some factors, but factor is unknown. Ligand can be bind the NKG2D, mica, and the ULBP. It is a ligand which that is show as a antigen, and but it is the self antigen, remember that things, and that is why it is the autoimmune disorder. And here is the infiltration and recruitment of the CD4 and CD8 adaptive immune cell, and it will produce due to the interferon gamma increase, and in this way remember that things, the inflammatory cytokines will recruit this from the follicular epithelial cell, and in this way it will represent to the T cell the CD4 through MSC one class molecule. In this way the pro-inflammatory cytokines will increase, will recruit more T cell, CD4 and the CD8. After this is the activated T cell, which that will increase the gamma C cytokines, interleukin 2. On the other hand, the T helper 1 cell will produce the interferon gamma. Both these cytokines is basically will lead to damage the hair follicle. And these hair follicles will be also the activated T cell will enhance to function the CD8 cytotoxic T cell, and it will recognize through MSC class 2 molecule for basically the MSC molecule to opsonize to kill the follicular epithelium, and in this way the complete follicle will be damaged and increase the inflammation. Let's understand about the epithelial cell, the bigger picture, and for understanding how the alopecia areata contain a different type of the cytokines, which that will lead to recruit the CD4 and CD8 T cell. This is the tyrosine kinase receptor, which the growth factor and cytokines, etc., bind and will lead to conformation change and will docking the JAK and JAK phosphorylation. On the other hand, the autophosphorylation will occur, will lead to recruit the STAT protein. This STAT signaling will lead to docking the STAT and in this way phosphorylation of the STAT will be activated, and this STAT is basically the transcription factor, will become a transcriptional factor. This transcriptional factor will go into the nucleus, into the DNA, and bind with the specific protein. Remember that things, a different type of the STAT like 1, 2, and 3 is involved. But in this video, we are just understanding the overview for understanding how STAT will work. So the different type of STAT will work. We will discuss about that. So the inflammatory gene transcription will lead to produce messenger RNA, and this messenger RNA will go into the cytoplasm and the translate into the several type of protein, and this pro-inflammatory cytokines will basically is the leukocyte recruitment. This leukocyte recruitment is basically will it will kill the follicular epithelial cell, because this is the follicular epithelial cell, and in this way the follicle will be even decrease, and whenever the live follicle hair follicle when decrease due to the hair follicular cell, and in this way the hair will be unable to grow, and that is why the hair will be lost. Follicular epithelium will produce the in the case of the alopecia areata disease contain interferon gamma, interleukin 2 and interleukin 7 as well as interleukin 15. These cytokines will recruit the CD4 and CD8 T lymphocyte, which that is the adaptive immune cell, and that is why it is the autoimmune disorder, because our own adaptive immune cell like CD4 and CD8 will attack the epithelium. So remember that things, it is the autoimmune disorder. The treatment is the JAK inhibitor, and the JAK inhibitor is the abrocitinib is for JAK1 specific, and the apadacitinib is the JAK1 specific also, while the brepocitinib is the JAK1 and type 2, and on the other hand the relactinib is right lactinib is the JAK3 specific, and basically the different names. And it is basically side effect of the JAK inhibitor is the acne, headache, nausea, urinary infection and anemia, thrombocytopenia and neutropenia, and the elevate the creatine level, and the increase the low density lipoprotein will lead to pneumonia, tuberculosis and sepsis. I hope you make sense about that. If you like my video, please make sure to subscribe, like and share. And I am also making the another type of the video which that is for the simple physiology related to the biology. So I hope you make sense. See you in the next video for this one. Bye. Please make sure to subscribe. Bye.